Good evening, and welcome to another edition of the WVU Alumni webinar series. Tonight, we'll be joined by three WVU experts to bring us all up to speed on some exciting advances in dental innovation. As our guests provide an inside look at the new technology and practices here at the West Virginia University School of Dentistry, be sure to take note and submit your questions by commenting below so that we can ask those to our guests at the end of the presentation. Joining us first this evening will be the Interim Dean of the School of Dentistry, Dr. Fotinos Panagakos. Dr. Panagakos received his DMD from the New Jersey Dental School, which is now the Rutgers University School of Dental Medicine, and his PhD in biochemistry and molecular biology in 1992. In 1999, he received his master's in education from Seton Hall University, and in 2007, he received his master's in business administration from Lehigh University. Before coming to WVU, Dr. Panagakos was a faculty member and administrator at the New Jersey Dental School and the Global Director of Scientific Affairs for the Colgate-Palmolive Company. Dr. Panagakos joined West Virginia University School of Dentistry in August 2018 as the Associate Dean for Research, and in January 2019, he was appointed Vice Dean for Administration and Research. In 2020, he was appointed as the Interim Dean. Dean Panagakos, hello.
Hi, Meredith. How are you?
I am doing well. Thank you so much for being here with us tonight to provide all of our alumni with a special update about the WVU School of Dentistry.
It's a real pleasure. Thank you.
I know that you have two other experts with you to help present tonight, but first, we'd love to hear from you about what's new and exciting at the WVU School of Dentistry.
Well, there's a lot that's going on here, and I don't want to take too much time from my colleagues, so I'm going to keep my comments brief. A lot of excitement here. We're fully into the spring term. Graduation is around the corner. We have a lot of excited students knowing that there's going to be an in-person commencement this year, and in lieu of what happened last year. So they're driving towards the finish line, as we say in the school here. We've got new faculty joining us from other institutions and other walks of life, so to speak, in dentistry. Really excited about joining our institution and really propelling it forward. We've taken on some new staff recently, which is always exciting, and we've had some staff in our school move to new positions, and that's always great as a leader, seeing your people thrive and flourish and then move into these other roles. It's just a great place to be right now, between dental students, the hygiene students, our residents. Even in this period of challenge that we've all been living through with COVID, we've been able to embrace the good things that are happening here at the school and using it to kind of buoy ourselves and to prop ourselves up a little bit, realizing that things are always there are good things happening around us, and we should take a moment to appreciate them.
I love to hear that. We, in years like this one, it's great to have some good news. And from what I understand, there are some plans for renovations underway. So could you give us a sneak peek of maybe what's on the horizon for that?
Yeah, so this has been in the planning for a while. The school really, there's portions of the school that haven't really been updated, other than like the dental equipment and what we used to treat patients, since the school was built in the mid-50s. And so, partnering with the foundation and our wonderful donors that we have here at the dental school, we've been able to put a plan together that will allow us to start renovating our existing building. We also are looking to move some of our operation that is offsite right now in the Suncrest Town Center, which is a shopping area about a mile away from the school, back to the school, and that is going to require us to do some renovations as well. We're finishing the first phase right now, which is our main reception area and our urgent care clinic where we see emergency patients. And then after that, we'll be rolling out additional phases of the project, working very closely with our partners in the Health Sciences Center administration and the university as well. And they've been extremely supportive and they've given us some extra space so we can kind of grow while we're doing this. So it's really an exciting time. And I would say in the next 3 or 4 years, the school is going to look very different than it does today.
Well, we're all very excited about that. I fortunately have not yet had to visit the urgent care section of your facility, and hopefully I won't have to, but I'd love to come and take a look when it's all finished.
You're welcome to come at any time.
Well, thank you, Dean Panagakos. I know we'll have more questions for you later in the program, but first I'd like to introduce you all to Dr. Lauren Yura Godwin to talk more about the Center for Dental Innovation. Dr. Godwin is an assistant professor of restorative dentistry, as well as the director of the Dr. W. Robert Biddington Center for Dental Innovation. She is a Morgantown native and completed her DDS degree in 2015. She is exceptionally passionate about educating our future oral healthcare practitioners, as well as treating her family of patients. Hello. We are so excited to have you here with us tonight.
Thank you. Thank you so much for having me.
Of course, of course. Why don't we get started with, tell us a little bit about the meaning of what an innovation center is and what being a CREATE organization means in your work.
Sure. So the CREATE organization stands for Center for Research and Education and Technology. And it was founded by Dr. Edward Rosamondo and other dental industry leaders in 2004 with the goal of creating a private practice-like setting within the academic institutions. And they would be equipped with the newest materials and technology that maybe the students wouldn't be exposed to while they were in dental school. Dental technology and equipment is very expensive, and sometimes it's difficult to kind of keep up on the cutting edge. And so these dental companies, and there's about 30 different dental companies that make up the CREATE organization, donate or consign dental equipment and materials to these innovation centers. And it's a really unique experience because each innovation center gets to choose from this large conglomerate of companies all the different materials and equipment and technology that they want to have in their centers. And so each center is a little bit different, and we can really tailor it to the needs of our students and our patients. There's currently 3 innovation centers in the country. The first one is at the University of Missouri, Kansas City, and then at West Virginia University, we were opened in 2017, and then the University of Mississippi was the most recent CREATE center to open. And our innovation center consists of 5 different operatories. Each operatory is sponsored by a different dental company, as you see here. And then within each of those operatories, we have a different set of materials and technology and equipment. So as the students treat their family of patients, they're able to have a really large breadth of experiences of different equipment and materials so that they can be more prepared and better practitioners when they graduate.
Wow, this is so exciting. I love to hear that we are one of 3 in the country, certainly.
Yes, definitely.
So how is the Innovation Center kind of integrated into the students' curriculum in the dental and the dental hygiene programs?
So for we try to start from the beginning because, like you said, it's a really unique opportunity for our students. So when they're first year dental students, we kind of introduce them to the center. We let them know what it's about, talk about the generosity of all these CREATE organizations for them to consign and donate all this equipment to us. And then when they're a second year dental student, they get a little bit more exposure. Maybe they're shadowing a 4th year dental student on a procedure. We implement it into some of the preclinical courses. And then when they're a D3, 3rd year dental student, we really kind of hit it heavy with the training and orientation into the center. So we are really focused on really good training because we feel that if, we really care about our patients, we want the students to be as prepared as possible when they're using this new equipment. So we spend almost, 2 full days as a D3 and then continued digital training when they're 4th year dental students, just making sure that they're very prepared and that they feel very comfortable. It's hard sometimes for students to go from a situation that they're very used to and kind of thrown into a new situation with all different things. So we spend a lot of time making sure that they feel very comfortable and really reinforcing ideas that maybe they learned in their preclinical years into when they're actually using it for real on patients. For the dental hygiene students, we have them come in when they're fourth-year dental hygiene students, and we kind of pair them up with dental students so that they can really kind of have that team dental approach that's really crucial, especially when they're going into private practice.
So it sounds like it allows the students to really have some hands-on experiences at various points, right?
Definitely. Yeah, we want to make sure that we're touching and grow. And as they're growing as students, they're kind of growing in the Innovation Center as well.
Sure. Well, and I'm sure we'll talk more about growth later on, but that allows for some other opportunities. You mentioned that there's some technology associated with the center. What type of technology? I'm asking on behalf of an audience that would love to know what that looks like. What type of technology do you have in that center?
Definitely. So this was one of the first points within the school's history that we really kind of got to introduce digital technology. So we have the Dentsply Sirona OmniCam with an MCX milling machine and a Speedfire oven. And basically in layman terms, it's the crown in an hour, or crown in a day. If everyone kind of has, some people have heard of that. You don't have to have a temporary for 3 to 4 weeks. And so we teach our students that technology. We also teach them different types of digital scanning. We have different intraoral cameras in each of the rooms that can detect cavities sometimes. We have soft tissue diode lasers that we train our students on. We have a CBCT and Panorex for the students. We have a variety of different powered periodontal instruments. They learn, the big thing too is just the materials, things that they maybe see on Instagram or Facebook, or they read in a dental journal, and then they get to actually have that hands-on experience to learn about it and then use it on their patients, which is really interesting. We also have an oral cancer screening device that they can use when screening for patients. So really a very large breadth of things that the students get to not just try out, but then really use in their treatment of their patients.
So this is all very new to me, and it sounds like this is all incredible technology that I hope I never have to come in contact with. But it's the type of thing that you're glad to know is out there for when you need it, right? And to know that people are learning from every day, and that the technology is evolving.
No, definitely, because West Virginia University has a wonderful dental school. We learn the fundamentals, and we have such a great family of patients that want to be seen here. And it's really kind of neat to see it taken to the next level by implementing this new technology that's really cutting edge. And really, when they go into private practice, they don't have to have that learning curve of things that they maybe have never seen before. They kind of hit the ground running in a new way. So it is a really unique experience for us, for sure.
So kind of speaking of that, what other types of impact have you seen on the students after, since the CREATE Center has opened?
It's been really neat, and I experienced it just this week, honestly, when we start to talk about the different materials that are on the market, and you start to see this rejuvenation or excitement. Sometimes it can feel a little weighed down with a lot of lectures, and it can seem, I don't want to say mundane, but it just gets kind of tiring. And then they start to see this kind of new, exciting technology, and they get to, use it for real with their hands. And it's just, you get to see them kind of excited, which is really rewarding. I think the other really neat part is that, they get to also share it with their fellow students too. So I have them do these presentations, and they learn about, the different materials, and they get to then teach it as well, which is really kind of a neat way to reinforce concepts. But the other really cool thing is, I kind of talked about this earlier, but with, Instagram or Facebook, I really can't tell you how many times that people will say, I follow this, this dentist on Instagram, and he uses this, and now I get to use it. So I think it really is just a passion about materials and a passion about dentistry. And people really tend to get excited because it's fun to work in this new, brand new private practice setting when they're used to, our main clinic is beautiful, but this is kind of to a next level. And so I think just their excitement is what makes it really rewarding.
I love to hear that. And, when we talk to alumni through our work at the Alumni Association, we also hear those types of stories about their experience at the dental school. So the work that you're doing is certainly very powerful. So going back to the Innovation Center, is that center just for dental students, or can it be utilized by other folks on campus?
So, our dental students are the ones that are treating their patients, but we're kind of very welcoming and open to having local dentists and alumni come into the center to see the equipment, the materials, and the technology that we have available. I mean, very frequently I'll have a local dentist or an alumni call me and say, I'm in the market for a new scanner or in the market for a new intraoral camera or something like that. And it's great. They can come with their dental team. They get to use the technology and experience it kind of without maybe the pressure of a salesman. They can kind of use it like as a mini showroom and and see the products that we have. And that's been really nice. And I think sometimes it's hard to get this equipment and get to experience it unless you go to like a large, the greater Chicago, like a big dental convention. So it's been really nice to have that here locally at WVU and really showcase West Virginia.
So, you've talked about what a pleasure it is for you to serve this family of patients. Really quickly, what is it that makes this career path so special to you?
Oh man, there's a lot of different things. I think dentistry is a really unique profession in the fact that somebody comes in with maybe something broken and having that opportunity to fix it like with your hands right there, maybe relieve their pain, I think is a really unique opportunity. And there's also a lot of other there's a lot of psychology that goes into dentistry as well, which is thankfully both my parents were psychologists, so I got a little training as I grew up. But I think that's the thing that I appreciate the most about it is that it's a tangible thing that you can do to someone and to really fix it or hope to make it better than when it came in. And that's what I find most rewarding about it. And I think the thing, not to be cheesy, but I feel like I have one of the best jobs in the world in the sense of being able to teach and practice it's rewarding from both sides. Seeing those light bulb moments for students and then also being able to, treat my family of patients in the same way. It's a really great experience. I'm very thankful.
Well, we're certainly glad to have you here at the WVU School of Dentistry. So for our audience, if you have any questions for Dr. Godwin, you can drop those in the comments box below, and we will bring all of our guests back in just a few moments later in the program. And in the meantime, I would like to introduce you all to Dr. Schincaglia. So Dr. Schincaglia received his dental degree from the University of Ferrara in Italy and his periodontal certificate from the University of Southern California. Since 2003, he has been a diplomate of the American Board of Periodontology, and in 2006, he earned his PhD in bone biology, also from the University of Ferrara in Italy. From 2007 to 2014, he was an associate professor and the director of the graduate program at the University of Connecticut. In 2016, he joined WVU as the chair and the postgraduate program director of the Department of Periodontology. He is published extensively in peer-reviewed journals, and his research has focused on implant immediate loading, periodontal regeneration, and bone biology. So, Dr. Schincaglia, thank you for joining us tonight.
Thank you for having me.
Absolutely. So as we heard from Dr. Godwin, digital technology is very important in the continued growth of dentistry and dental education. So I heard that you could talk to us specifically about the importance of digital technology in implant dentistry.
Yeah, actually dental implants has been the last couple of decades a revolution in treating patients without teeth. And that's probably one of the possibility to put an artificial root on top of which we can allocate a tooth and bring the patient back to normal function. Now, this process is not very simple. It requires a lot of analysis and preoperative evaluation. And sometimes a case like you see here on the screen from the left side to the right side, it seems easy, but it requires a lot of precision, accuracy, and good execution. And it's very easy to make mistake, and the result is not going to look as nice. So the normal placement of an implant requires the use of multiple burrs that basically create a drill inside the bone. I know it's not really a pleasant thing to describe. That's why I didn't bring picture for that. And during this process, you can make mistake. You can have imprecisions. And when we place implant in free hands, besides the accurate planning and diagnosis, the mistake that you can make is up to 12 to 16 millimeters, and from 0 to 16 millimeter, and from 0 to 35-degree angulation. Now, those are extremes, of course, but you can have significant changes in the result of the outcome. So that's where the digital technologies come in to help by improving the accuracy in both in the planning and in execution phase. And has been an ongoing process for the last, especially start at the beginning of the 2000, during 2002, 2003, when they introduced first a computer-guided surgery. And now we are in robotics.
So what parts of that digital technology are available at the WVU School of Dentistry?
We actually have quite a bit of it. And as Dr. Godwin just mentioned, some are thanks to the Innovation Center, but also we have it in the Department of Periodontology and Prosthodontics, where we have the specialty programs. We have, again, intraoral scanners. Instead of using the classic mold to take the cast of the patient, we use this intraoral scanner that just take multiple pictures, and you don't have to have that horrible paste in your mouth, gagging for 5 minutes anymore. Plus, this cast is basically digital, so you cannot break it. It cannot fracture. You check it immediately for precision and accuracy. We have a benchtop scanner, which can be useful to scan an existing model of the patient. And all these technology result is to produce what we call STL file. Those are like files that are used in industry to create a three-dimensional pictures of an object. These files are then utilized, but we use the planning software. So we have special softwares that allowed us to plan and put all these parts together and carefully and accurately plan the position of the implants in relation to the patient bone, position of the jaw, making sure that we don't encroach vital structure. We have also a 3D printer, which is allowed us to develop and print out parts that are used to direct the implant exactly where we want it. We call it surgical guides. Okay. We have a CEREC milling unit, is part of the Innovation Center, but sometimes we borrow it. And then we have the last jewel of the all, which is the robotic navigation unit. And I'm proud to say that we are the second school in the world that can use this technology, which is basically the only robotic arm unit that allow the robotic placement of dental implants.
It's amazing to robotic navigation. I have to ask more about this. To be the second school in the world to be able to use this is just incredible. So please tell us more about what that machine entails.
This is basically the machine has a robotic arm. You can see with those 3 metal joints. What we do, we upload the image of the patient skull. The image is acquired through a CBCT scan, a 3D scanner, and a radiographic device. And the image get uploaded to the machine, and then the patient get connected to the machine, to the robot, to To do that, we have to connect the patient using a plastic tray, to a fiduciary. The fiduciary is that black device that the patient has connected to this mouth. And with that, the patient takes an X-ray. This radiographs allows us to the computer to orient the patient exactly in a 3D of the space. So what we do, we disconnect the black device, which has those little metal spheres that get picked up by the robot, and then we attach the patient literally to one of the two arms of the robot. So one arm of the robot is connected to the patient, and the other arm know exactly where the jaw of the patient is and drive perfectly the position of the implant with a 0.5 millimeter accuracy, which is way higher than what we had freehand placement, as I mentioned earlier.
I am very impressed.
We are too.
Whenever folks ask us on the road about what's new and exciting at WVU, this is going to be the first thing that I mention from here on out. So tell us, what are some of the advantages that having this cutting edge technology at WVU brings to the School of Dentistry?
Well, of course, a young dentist needs to know how to do things in an analogic way, so like the old-fashioned approach. But technology runs very quickly. Especially, I was listening yesterday to a webinar with the COVID infection and all the risk of transmission of bacteria through just a regular impression mold and cast obtained from that. The use of digital technology has had an extreme fast acceleration the last few months. Everybody's running using this device because there's less risk of contamination. Having said that, when we introduce these technologies in education, we have the possibility to educate our students and residents to the newest cutting-edge clinical protocols and technique. So that's take us, of course, on an advanced stage. So when they go out in practice, they're not surprised by these new devices. It's also important, especially for me that I'm training residents, so postgraduate students, to expose them to complex cases that otherwise will require my very strict supervision for patient safety and for results. Having this technology, robots and computer-guided surgery, especially for implants, allows to have a very precise execution, with a good control of the patient's safety and final outcome. Then there is a research component. The research component allowed us to be on the developing side of all these techniques. So as an academician, I always look for areas and topics to explore and to develop with research protocols, and of course try to be up there as a opinion leader. And that's what these technologies give us as an opportunity to be the avant-garde of this science. And at the end, but not at the last, is the quality of service we can offer to our patients. Because again, West Virginians can have a really cutting-edge level of treatment. And we are very proud of that, and all the group and the residents and the students are very proud of that. And digital technology allowed us to reduce morbidity, expedite healing, reduce intraoperative and postoperative discomfort, and improve accuracy with the quality of the final results for the patient and for the provider.
This it just is one more reason to be so proud to be a part of of the WVU community. And so I have one more question for you, sir. You have studied and researched and practiced in so many places around the globe. And so I have to ask, what is it that delights you about your work here at WVU?
Well, here I can do things that I cannot do in Europe. There is a whole array of instruments and opportunities that Europe doesn't have. Europe has Europe has invented implants, and implant osseointegration is born in Europe, in Sweden and Switzerland. But here we had the forefront development and application, and especially true now with this boost in technology. When I show off a lot when you go back to Italy, and I say that I have the first robot in the world. So I'm really proud of West Virginia University.
Well, we are so glad that you chose to bring all of your resources and research here to WVU. So thank you for sharing that with us. I'd like to welcome Dr. Godwin and Dean Panagakos back on screen as we start to take some questions from the audience. And while the audience continues to submit their questions, Dean Panagakos, we have one more question for you, and that is, what is on the horizon for the School of Dentistry? What's next?
I know Dr. Schincaglia would like us to get a second robot, but we're going to just...
Oh, one is enough.
One right here, one is enough. There's a lot on the horizon, and it would take a lot of time to kind of go through all the wonderful things that are just down the road for the school. I think one of the areas that I'm paying special interest in is making sure our education program, just like our clinical experience that Dr. Godwin is providing through the Innovations Center, and the strides that Dr. Schincaglia is making with regards to the robotics, we also look at how are we training our students to be competent general dentists when they leave the school, as well as a competent dental hygienist. This is a picture of our simulation lab. This really hasn't changed much since I went to dental school. It's much nicer, but it's a very similar setup. You have a mannequin head, you have plastic teeth, and this is where you learn all your psychomotor skills. About 15 years ago, they started to introduce very early stages of virtual reality. So you were actually working on a virtual mouth, not a real mouth, or a fake, I should say, a mannequin mouth with your handpiece. And these were good, and I've actually seen them when I was working with Colgate. I did a lot of travel in Europe, and there are a number of schools that have large spaces with 10 to 20 of these units set up, and I've tried them, and they were pretty good for the time, but they were limited. Recently, we've seen some new technology come out. This company, for example, has a model that sits on the bench top that connects directly to the student's laptop computer. It's a little too expensive to say they're going to buy one of these and take them home and work, but eventually I think the price point may reach where we at the school could actually have maybe some of these, and like a library, you can borrow one for the weekend and take it home and maybe bring it back. What's really exciting, though, is a new entry into the innovation area regarding virtual reality, and that's the SimToCare units. And this is one of the units there, and you can see a display. It's the next generation of virtual reality. And what's really neat about this system is that you can actually program in patients to practice on. So using the technology that Dr. Godwin and Dr. Schincaglia mentioned, the scanning technology, if you're a dental student and you're seeing a patient next week and you're going to be doing a certain procedure, you can take a digital scan of that patient's mouth, go into the simulation clinic, and actually practice the procedure before the patient comes in. So it can give you some confidence relative to being able to handle the treatment. It also allows the faculty to take a look at what you're doing, either in real time or on video afterwards, on a video recording. If you make a mistake while you're doing something, say you're preparing a tooth for a crown and you over prepare it, you took away a little too much tooth structure. If you were working with the plastic teeth, you'd get up from your chair, you'd walk over to your locker, take another tooth out, put a tooth in, and start from scratch. Here, you can back up the tape, you can rewind to the point where you made the error and start from there again. So it actually allows you to self-correct immediately versus having to, you could be 2/3 of the way through. And what's also nice is that they have a lot of programs that are already programmed in to the SimToCare. So there's different types of cases. They're including now periodontal cases for periodontal treatment, as well as for hygiene students to practice what they're doing. And again, you can actually create your own cases. So we've actually looked at this. We're not ready to adopt this yet at the school. It's still a little early for us, and it's kind of early out there right now. And I think talking to the faculty, and one of my approaches to everything I do here is that I like to get groups of people together to discuss things and to decide together what are we going to do as an institution, and make the decision as a team. The team is very excited about this technology, but they all said, we've got so much we still have to do with the technology we have at the school right now. Let's make sure we're doing that fully before we bring some new toy into the picture. And that's fine. And that's going to be something down the road. It's something that we hope will be able to attract maybe some of our philanthropic supporters to maybe support us getting some of this equipment down the road. We're already planning where is that going to go in the renovated building here at the school. So it's on the horizon. We're kind of keeping an eye on it, but I think that's going to be really exciting, and it will augment the lab that I showed you at the beginning, where the students were just working on the mannequins. That's not going to go away. That's going to probably be the mainstay, but this will be something to augment and allow students to practice and do things that they normally couldn't do in the simulation lab.
Well, this is all so exciting. We have some questions from the audience that we'd like to get started asking. I know we have quite a few, so I'm going to get started right away. If you're out there listening, please go ahead and continue to submit questions. We'll take as many as we can. I know there are folks that are anxious to hear some answers to their questions. So our first question for tonight is for Dr. Godwin, and that is, how do you see the Innovation Center growing and evolving in the future?
So that's a good question. Right now, we're kind of limited to, we're not really limited, but mostly doing restorative procedures like crowns and fillings and some periodontal work as well, but mostly in the restorative realm. It would be interesting to see if we could expand and maybe, because there's lots of dental materials and lots of different disciplines. So endodontics, or, those who do root canals. That way students are really kind of learning about all the things that they're going to be using when they go into private practice, and maybe just not, just the restorative section. So that's one area that I really could see us expanding. And the other was potentially with practice management. I think that's an area that, when students graduate, they learn a lot about dentistry, but a private practice is a small business. And so maybe, we can start implementing with a lot of our alumni, maybe some, like a little apprenticeship with students who are in the Innovation Center, and they can talk about their practice management and the things that they've learned when they're in small business. So that's some ways that I think that we could really see it growing.
Excellent. Thank you. Our next question is for Dr. Schincaglia, and that's, what are some of the ways that the United States is unique when thinking about dental implants and technology?
Well, I mentioned earlier that I think most of the science on dental implants started in Europe, but America has always been the forefront for new application and development, and a little more aggressive approach. But that's led to where we are now today. We are using new materials and the more and more combination technique like this computer guided and robotics is born here, and that's I think that's where things will go in the future. There's still a lot of just for saying it, that the percentage of population that is in need for implant but doesn't have implant is very high. It's still very high in the United States compared to other countries. So we are not at the top notch in terms of implant user, and still there's a long way to go in terms of application and getting through population to get fruition of this service.
Awesome. So our next question is about the Innovation Center. Will you offer tours of the Create Innovation Center during alumni reunion weekends?
Absolutely. And honestly, pre-COVID, that was definitely something that we were doing. And I think that's something that will definitely continue on, because the more exposure, the better. So absolutely, come on by.
I know a few people on our team who will be signing up as well. Our next question is along the same lines. Do the products and companies that sponsor each room change year after year?
So not year after year, but they are really great about it. There's something new that comes out onto the market that they really welcome our requests. Sometimes dental equipment, it's similar to an iPhone. So it's every 18 months or 2 years, something new comes out. And the CREAT organization is really great about when we see those new things and keeping up on that cutting edge and replenishing, or kind of swapping out new technologies. So, yeah.
Excellent. Our next question, you all might have some varying perspectives on. What do you think is the biggest dental myth that people need to be aware of?
That's a good question.
Aware of, or just remove the myth, because I think the thing that pain is still connected to dentistry, I don't think is really true. We can really do a lot to reduce that pain and anxiety. We can really work on we have improved a lot on that department. That's what I find on.
Yeah, I mean, I don't think there are any myths that I can come up with. I mean, being Greek, I'll just say don't use Windex if you have a toothache. From our favorite Big Fat Greek Wedding movie, don't do it. I think the whole myth of dentistry being equated to a painful situation, and a lot of that comes from, you may have had a really bad experience as a child, and that carries over. I mean, I saw a patient this morning in the clinic where I was in our emergency clinic who, pretty much said, I don't want to be here, and the only reason why I'm here is because my husband made me come because I'm in pain. And so, and at the end of the session, I said, so how do you feel? And she says, I feel better than I thought. And, I feel calmer. And I said, well, this is the kind of environment we try to foster here at the school. Even though we're an educational institution, we're also, we're a dental hospital. We're treating people with an illness. And you have to have compassion. You have to have empathy. You have to understand where they're coming from. And I think just creating that, that calmness sort of as, really put this patient at ease. And I've seen it before. And I think that's one of the wonderful things that we offer here at the school when patients do come for care with our students and our faculty and our staff.
We have another audience question that might be similar. What's the most common question you get regarding your research or your practice?
Common question.
I would say that a common question I get is, what do I enjoy doing most? I mean, I think that's a lot of patients will like to ask that question, like, what part of dentistry, do you enjoy? And so, and I think that's the great thing about general dentistry is you get to do a little bit of everything, and then when things get hairy, then you send them to Dr. Schincaglia, and then he'll take over the other part.
Yeah, I have to agree. I think, being a general dentist as well, it really allows you to decide, what do you really want to do when you go to practice. And, in where I'm from, originally in New Jersey, we had specialists all around us, and you could actually refer a patient very easily. If you didn't want to do periodontal therapy, there was a periodontist that you could develop a relationship and refer your patients to. I think it's a little bit different here in West Virginia, especially after you get outside of Morgantown or Charleston or Huntington or Wheeling, out of the more built up areas, to the real rural communities. That general dentist may have to know how to do a lot more because there is nobody to refer to. And I think that really puts an even greater burden on our school, because many of the students who come here are West Virginia residents who go back to their communities to practice. And so it's almost like we have to take it up. We have to take it up a notch versus maybe some other schools that maybe if they don't get as much periodontal, experience or enough experience doing root canals, it's okay. There'll be a specialist that they can refer to. And we take that very seriously in giving our students that broad experience so that they are prepared when they go out to practice.
Sure. So, thinking about you mentioned the implementation potentially of the private practice management. We have a question about how are the students currently educated on how to run a practice and the business side of things?
So in their fourth year, in the summer between their D3 and their D4 year, there is a practice management course. And it's a really great course where they bring in a bunch of different disciplines that involve insurance and, financial aspects of it. And then they have private practice dentists from all over the state that come in and also provide that knowledge. So it's it's a neat course. They practice writing a business plan and things like that. So they definitely have some exposure, but I think it's definitely an area that we could see really kind of it on and the innovation scene, but maybe being that platform for that.
Yeah, and the other piece which we really didn't talk about, which you look around and there's so many jewels here at the school that you like to point out, whether it's the Innovation Center or our foray into robotics or the renovations that we're doing. The other real big part of our curriculum in the fourth year is our students go out to rural practices for 6 weeks. They leave our school and they go and they practice in a private practice setting for 6 weeks and provide care to those in the community who otherwise may not be able to get dental care. And many of those private practices are alums of our school, and they are faculty on our program, and they welcome the students in, and the students treat patients. And on average, there's about $5 million of care that's delivered every year through this program that the patients don't have to pay for it. Usually the practitioner is either charging a very nominal fee or just covering some costs, or maybe even giving it away for free. And the experience that they get, not only in private practice, building on the experience they get in the Innovation Center, is that they also get to see how a practice runs in real life. They may get to see, wow, there's a staff member who needs to be reprimanded because they're not following the rules. So they get to see potentially part of that, or they talk to the doctor and they learn about that, or how to do billing, or how to do scheduling, or how to do things that here are done very differently because we're in a school. And so that's a real important part of the practice management curriculum as well. But to Dr. Godwin's point, we can always do more. And we're looking to see how we can incorporate additional experiences during the 4 years so that we can do the best job we can. I think having been in private practice, you really learn by being in a private practice. That's really where it's going to happen. But maybe we can do a little bit better prepping them.
Well, I'm excited to see how that develops. And we have one more question from the audience. And this one is for Dr. Schincaglia, and that's, what makes a patient the perfect candidate for a robotic implant?
Well, we can, somebody that needs an implant, we can place implants on anyone that needs it, from patient with teeth and patient without teeth, completely dentulous, and is a procedure that can apply to everyone at this point. Actually, the procedure is very fast because we don't have to go through all the steps that in a traditional way. So the surgical placement is like 10-15 minutes in general. So it's very quick.
Well, thank you all so much for sharing this insightful update with all of us tonight. I know there are a couple folks who would like to know how they can stay up to date and follow along. So what's the best way for folks to stay in touch with the School of Dentistry?
Well, the best way is obviously to access our website. We're constantly putting up new information there regarding whether it's the renovations or activities and things that are going on. In addition, we have a Facebook page that you can follow. We have a LinkedIn account for the dental school, as well as a Twitter account for those that are, into those social media platforms. And then you can always contact us through our website, and we can add you to our email list. And once a month, with our great partners at the foundation, we put out an e-news, and it's really an update on what's new and exciting and happening at the school. And you can receive that right in your email box, and it usually links to full-length stories on our website, so you don't have to go looking for them. So a lot of ways. And then last but not least, if you want to come for a visit, once visits are back to being in vogue, just call the dean's office and say you'd like to come by and see the school and what's happening. And we always welcome visitors, and we'd be happy to give you a tour. If there's construction going on, we might put you to work putting up some sheetrock or maybe painting a wall just to kind of get a little feel. No, we wouldn't do that. Safety wouldn't allow us to do that. But seriously, we would love to give you a tour, take you over to the Innovations Center, to where our postgraduate programs are. We're very proud of what we have here, and we want to share it as much as possible.
Well, we will certainly take you up on that offer. And I want to, again, just reiterate how much tonight has been a reminder of how important the work is that you're all doing, both as practitioners and as researchers, and then additionally as instructors. I think I have seen firsthand what the work of great dentists can do for one's confidence, especially in my own smile. And I'm very grateful for that. So I want to say thank you to all of you for lending your time and careers to such an important work here at WVU.
Thanks. Thank you, Meredith.
Thank you, Meredith.
Absolutely. We'll see you over at the Innovation Center.
Okay, great. Thank
Absolutely.
you.
All right. For those who have joined us at home tonight, thank you for tuning in to another segment of the WVU Alumni webinar series. Next Wednesday, in lieu of a webinar, we'll be focusing our attention on the 24-hour WVU Day of Giving. And if you're wondering which cause to support on March 3rd, head to dayofgiving.wvu.edu to take a look and plan your gift for March 3rd. If you aren't already a member of the WVU Alumni Association, March 3rd would be a great day to become one. It's also a great day to purchase a brick or paver on the Alumni Walkway. And we'll be back online for the next episode in this webinar series on March 10th for a special interview with WVU alumnus Jamie Sherry, as we get to hear firsthand his experience in helping to make the COVID-19 vaccine available to the world. So thank you all for joining us tonight, and we will see you on March 10th.